I like to kind of empower the women to take control of their own health. I mean, we talk about so many things other than just the pregnant woman. We talk about how to take care of your body, what the menstrual cycle is all about. If you wanted to try to interrupt that with whether it's a birth control or if you wanted to interrupt it because you're planning a pregnancy, we talk about all types of different things that people can empower themselves with. And sometimes we don't get that opportunity to do it if we're just doing 5-10 minute intervals. So we like for the patients to come in even at the beginning, preconceptually, all the way up through the menopausal age.
You know, it's great for younger girls to come in and start their gynecologic care in their teenage years, to have an understanding of a healthy reproductive system and safe sex, birth control, contraception. There's so many options out there, and to have a good baseline and somebody to be able to talk to about what's out there for them is, you know, we really embrace that. And also to help debunk, you know, common misconceptions about sex, birth control, menstrual cycles, and pregnancy. You know, there's a lot that people don't understand, and we're here to kind of give some clarification for that.
Absolutely.
I had a patient just a couple of weeks ago who came in, and we sat down and we talked, and she had questions that lasted forever. And that's fine. Yeah, there are no dumb questions, because if you don't ask and get the correct answer, you're always going to be wrong. So I'd rather you ask whatever. But this young lady, she came in and she had seen some of the doctors, and after I sat with her, she goes, you know, I really like coming to a certified nurse midwife. And I said, yes. I said, because we're sweet. And she says, no, because I feel comfortable speaking to you for whatever reason rather than a doctor.
But it also helps them get information, like you said, that they have to step away from Google and actually listen to somebody who actually has some sense. Because we all went to school, we got a master's degree, we understand the human body, and we look at it from a natural, normal physiology, as opposed to looking at a disease process.
Yeah, that's what I was going to say, is that our background is nurses, so we were nurses first. Nursing is more caring, it's more holistic focus, it's more
Compassionate.
yeah, but like looking at the whole person, as opposed to medical education is more looking for pathology, and so it tends to maybe be a little more cold, but
I think we kind of embrace our patients with not just a professional relationship, but with a personal relationship as well, and kind of tie both the professional and the personal together in our patient care.
Right. And again, we absolutely love working with the providers. We like consulting with them, and
We're a
they're
team.
right there for us because it works best as a team. However, sometimes if the patient feels like they need a little bit extra, they can always go on the internet and do an Ask a Midwife or Ask a Nurse if they have questions, but sometimes that personal sit-down talk with them, they'll think of questions that they didn't know that they actually had, because one question will lead to another question.
Yes.
And so we enjoy spending that time with the patients.
And it's also nice to have the husband in there, because you'd be surprised how many times a husband will be sitting there going, I never knew that.
Yep.
Thank you for answering that, because I was
Absolutely.
always afraid to ask.
Absolutely.
Their husbands and boyfriends and significant others are very, very much a part of our practice.
Absolutely.